That's right. We're talking about organ transplants during this time, during the pandemic, and what we need to know. We have Dr. Richard Gilroy, Intermountain Healthcare Liver Transplant Medical Director. Thank you so much, Dr. Gilroy, for being with us.
Thank you very much, Pat, for having us.
Well, let's talk about how things may or may not have changed when it comes to organ transplants there at Intermountain.
I think the most important thing that we were confronted with was an environment that changed, and we're used to that in transplant because it always constantly revises. We had obesity affecting organs. Now we have a disease that's affected how we practice. And within the institution, we have an exceptional series of individuals who are all around designing how we would work. And so we've actually increased our numbers of liver transplants for the year, and we anticipate that that will continue into the coming years.
Well, we can understand that organ transplants are essential. They are life-saving measures, but we also know how tricky it can be when it comes to the immune system and what measures you have to take before, during, and after the surgeries. What types of changes are in place? What do patients need to know?
Well, that's a very good question that you raise. The most important thing is they need to understand basically what are the terms probability. When you get listed for a transplant, the probability of survival when you're on a transplant list nationally is that 2 out of every 5 people are removed from a liver transplant list without getting their offer of life. Then we compete that against what I'm going to say are concerns, and they are real concerns about the COVID infection. And so what we do to address those concerns is we screen the donors, we screen the recipients. We have a hospital that has a prevalence of, even amongst the caregivers within the hospital, the actual rate of COVID infection that's occurred amongst caregivers here is lower than what occurs in the country. So what we have, or at least the state in which we live, the bottom line is the most important thing is to make sure that you have processes in place to assure optimal safety for any individual. And so we've done that with hand washing, with face masks. We have available to us also additional testings like antibody testing and viral load testing that can be turned around quickly. And then finally, and most importantly, we have a transplant community and individuals in the community who, if ever faced with a tragedy, consider organ donation first. And then we do the work to make sure that organ donation is safe, because death on a wait list is a bad alternative.
Dr. Gilroy, I think the message is that organ donations and transplants are alive and well right now through Intermountain Healthcare. You have an example of someone from Ogden who just went through the process successfully.
Well, we have an example of someone from Ogden. We have someone from Idaho as well who went through the process 2 days ago. The bottom line is what we're doing is that we are seeing individuals who are getting transplanted. We give them the information, and our world is uncertain, and we provide them every piece of information that they have available. And someone on a wait list chooses to take a risk because they can never know every piece of information about a donor, nor every piece of information that might occur subsequently in an operation. But what we have is assurance that our outcomes will always be better than predicted. And for patients, if you need a transplant, we are operating, and all of the facilities around the country are operating to assure that you receive these in these difficult times.
Dr. Gilroy, thank you so much. All important information for these patients to know that they are going through, and we hope that some of those restrictions for living donations will also be lifted. If for more information, please go to our website. We're going to have all the link from intermountainhealthcare.org. We're going to have it on our website, abc4.com. Thanks so much again, Dr. Gilroy.
Thank you very much. And the Living Donor Program is off and running as well.